From iHeartRadio, this is Medical Monday, presented by St. Dominic's. This is Randy Bell, and I'm here with Dr. Christen Haygood, who is a GYN oncologist at St. Dominic's. We're going to be talking about ovarian cancer awareness. And Dr. Haygood, it's true, I guess, of all cancers that early detection can help to save lives, but especially so with ovarian cancer because so many women may not notice the symptoms until the cancer is more advanced. Is that true?
Yeah, that's right, Randy. It's a good thing to think about early detection, and we have lots of good tests for other cancers that people are very familiar with. So mammograms for breast cancer, colonoscopies for colon cancer, pap smears for cervical cancer. Unfortunately, we don't have a great screening test or an easy early detection test for ovarian cancer. The tests that we have used that sort of suffice as a help are ultrasounds. We have a blood test that we can use. But in general, for screening, those are not great tests. So what becomes pretty important for patients when we're thinking about ovarian cancer is that women are really just aware of their body and their own symptoms, and that they have someone like a primary care doctor, an OBGYN, someone that they trust that they can speak to about symptoms and be evaluated.
And I guess if there are warning signs, they're more subtle.
A lot of times people will say, well, I noticed, I had a little bloating, or my stomach got a little bit bigger, or changes in my bowels, or I couldn't eat as much. But typically, it's not just one thing that points to that.
Let's talk about the risk factors. And I know there are several for ovarian cancer.
And I always tell my patients, you had one risk factor, and unfortunately, we can't do anything about that one. It's just age. But I think that's a good thing to keep in mind, that as we get older, as women start to age, we do go through changes such as menopause that make really a lot of things feel different. But keeping in mind, hey, this is normal for me, or this is not normal for me, and knowing what some of those persistent symptoms are can be very important. Now, other risk factors that I think it's also very important is to talk to your family and to know your family history. So if you know that mom had a cancer when she was young and it was in the abdomen, it could be important if you could get any more details to find that out. Because now, I'm almost 10 years into practice, and at this point, we know so much more about hereditary cancer syndromes. And probably if there is a way that we can impact significantly the mortality rates of ovarian cancer, it's going to be in screening for family history, because that means we can offer women risk-reducing surgery, and that's up to probably 25 or 30% of our patients with ovary cancer that do have a hereditary genetic syndrome that potentially we could have caught earlier. And we won't say that we prevent all of these cancers, but we reduce the risk to about 1 to 2%. About 50% of women will not live 5 years with ovary cancer. And so if we can help the public be more aware, if we can raise funds to maybe develop a better screening test to help people be aware of their family history and how important that is, particularly for ovary cancer, I think maybe we can impact those mortality rates in the future.
And during this month, September, Ovarian Cancer Awareness Month, you will see a lot of teal ribbons out there. That is sort of the team color.
You'll see a lot of us wear teal. We also have a very big fundraiser in the Jackson area. This is super exciting. St. Dominic's and Nukes Cares have partnered for the last at least 8 years that we have raised money here in the Jackson area for ovarian cancer awareness. And a lot of those funds stay local, but it's a ovarian cycle. It's at the district. This year it's going to be on September 22nd. You can sign up and you can come spin ride with us, which is super fun. We also always have a lot of great instructors, and you will get a very good hour of exercise. And then we'll have food from Nukes. There's going to be survivors tables. Survivors can register for free. So it's really a great event just to wear our teal to help promote ovarian cancer awareness and hopefully raise some funds.
Dr. Christen Haygood. Medical Monday is presented by St. Dominic's. This is Randy Bell.